Hello everyone, I hope that you are all well. This week we're going to be going over chapters 14 and 15 from the Cooper book. These chapters will be covering positive punishment and negative punishment. Within this presentation, we will be covering TCO item G19 from the Behavior Change Procedures section. This specific TCO will focus on defining and implementing positive and negative punishment procedures. However, this specific chapter is focusing on positive punishment procedures. Okay, so let's start talking about the topic of punishment. Before we jump into defining punishment and explaining the different punishment procedures, I want you guys to think about how you generally perceive punishment and how the general population perceives punishment. Okay, take a second, think about it. Do you have negative feelings towards punishment? Do you have positive feelings towards punishment? Are you completely against the use of punishment, right? Like, just think about within yourselves, how do you feel towards punishment? How do people that surround you feel towards punishment? All right, so you should have spent some time thinking about, your general perceptions of punishment. Now I want you to consider these examples that I'm going to give you and these pictures that I have on this slide. Has it ever happened to you where you're walking down the stairs you're running down the stairs and then you fall? What are you going to do after? Right? Did that scare you into not running down the stairs anymore, or did you continue running down the stairs in the future? What about this has definitely happened to me. It used to happen to me a lot more when I first bought my toaster. But when I first bought my toaster, I was trying to figure out which setting was the best setting to put my toaster at. And I would always put it just slightly too high, which would result in my toast getting burnt. And obviously no one likes burnt toast. So over time, what happened was I learned the appropriate setting and I stopped putting my toaster on that high setting, right? So then eventually I ended up getting toast that I did like at the correct doneness, at the doneness that I felt comfortable with. And I didn't end up with burnt toast anymore. All right. What about this next example? Have any of you guys ever gone to the beach or a park and you're eating some food and then you walk away from the bench, or if you're at the beach, you walk away from your place at the beach and the seagulls come and they eat your food? And this happened to me one time. I had seagulls take a whole sandwich of mine. Right? Has that ever happened to you? And if it has happened to you, how have you modified your behavior in the future? Did you mind? Right? Did you continue to walk away from your place at the beach in the future? Or did you learn that you shouldn't walk away from your food in the future just so that the seagulls don't eat your food? Think about how your own behavior was changed. And then this one's a really common one. Parents always tell their kids, don't touch the stove, you're going to get burned. And then some parents will say, oh, let him touch the stove, let him get burned so he can find out what happens. And you have to think about why do people say that? People are saying that because they expect that when a person touches the hot stove, that they're going to find out that it's a painful stimulus. They're going to come into contact with the consequence, which is painful stimulus. And they expected that they're no longer going to touch the stove in the future, right? Most people, when they think about punishment, they think of negative things, right? They think about punishment in the form of torture, in the form of timeout, maybe they think about spanking, right? People generally think of these particular examples, these negative examples, you could say. But people don't tend to think of punishment in terms of these other examples that I have on the slide that I just went over with you guys. Something as simple as you put your toaster on a setting that's too high, your toaster ended up getting burnt, and now in the future, you're not likely to put your toaster on that setting anymore. That's an example of punishment. And the example of you running down the stairs and falling down the stairs, and so in the future you don't run down the stairs anymore, that's also an example of punishment. Punishment is necessary for our survival. We have to learn, right? We have to come into contact with those punishing stimuli, with those aversive stimuli, or to have something that we really like taken away, just so that we can learn from these situations. And a lot of these responses have survival value. Okay, so punishment is not something that you should be viewing as bad, quote unquote bad, because punishment is going to lead to learning just the same way that reinforcement is going to lead to learning. So as you could probably tell from the previous slide and the examples that I gave you, punishment generally tends to be viewed by people in a negative light. But that's not the case. Like I mentioned to you guys, punishment provides a way for us to learn those survival-related behaviors, right? Behaviors that are necessary for survival, and other behaviors as well, not just behaviors that are necessary for survival, but it allows us to learn other behaviors as well, just the same way that reinforcement does. So punishment is a basic principle of operant conditioning. And it is, like I mentioned, often misunderstood. It is also often misapplied. People often think they're implementing punishment when they're not implementing punishment. They're implementing maybe some other intervention, or they're implementing what society tends to view as punishment, but it doesn't fit the parameters of what punishment within behavior analysis should look like. And then the final bullet is very obvious. Punishment is also seen as controversial. Okay, there's a lot of people that are against the use of punishment, but like you just saw in the previous slide, punishment extends beyond some of those typical or traditional views of punishment by society. People tend to think of punishment as physical pain, loss of privileges, fines, timeouts, right? All of these, jail time, all of these things, that's what people tend to view punishment as. But there's so much more that goes into punishment, right? Like the example that I gave you guys about putting your hand on the stove, that's an example of punishment. You put your hand on the stove, you contacted that painful stimulus after, then your behavior reduces in the future. Okay, so then this leads us to our next point. That punishment is not this negative thing, right? Or this bad, quote unquote, thing that society tends to phrase it as. Punishment is, within behavior analysis, like I said, a basic principle of operant conditioning. That means that there's a response consequence contingency that is suppressing behavior in the future. If the behavior suppression is not occurring, right? If the behavior does not go down in frequency, then guess what? That is not punishment. So think about this, right? Like think about the traditional view of punishment that I just gave you guys examples of. Jail time. A person commits a crime and then they go to jail. Society views jail time as this punishment for a person having engaged in a crime. They're going to get locked away and then they're not going to engage in that behavior anymore. But guess what happens? When people go to jail, there are very high recidivism rates. So when a person goes to jail, they get out of jail, the likelihood of them landing in jail again for committing a crime or that's the same crime or a similar crime is very high. Okay? So they end up they relapse into criminal behavior again. So if we look at the definition of punishment within behavior analysis, by definition, the behavior must be suppressed in the future in order for it to be considered punishment. So if a person is being sent to jail after committing a crime and they are continuing to engage in that behavior after getting out of jail, does that classify as punishment within behavior analysis? The answer is no. So we need to look at the response consequence contingency. What was the behavior that the person engaged in and what was the consequence that followed? Okay, we know the response, we know the consequence that followed. Now, did the behavior go down in future frequency? If it did not go down in future frequency, then it is not punishment. Punishment requires, just like reinforcement requires for a behavior to increase in the future, punishment requires for a behavior to decrease and be suppressed in the future. Okay, so you could think about the same example with reprimanding. Right, this happens to me all the time. I reprimand my son. I'll tell him, no, don't do that. Let's say that he threw water on the floor and I'll be like, no, don't do that. And then he looks at me and he just laughs. And so is that an example of punishment? We cannot just look at the response consequence contingency, right? I can't just look at his response and say, okay, he threw water on the floor and then mom said, no, don't do that, right? Mom reprimanded him. That's not enough. We cannot just look at that contingency. We need to look at the future frequency of the behavior. Did my son's behavior of throwing water on the floor go down? In my son's case, it does not go down, unfortunately. Reprimands don't work for him very well. He sees it as like he's just receiving attention, and he finds it to be funny. So it doesn't work very well for him. It's definitely not a punisher for him. Okay, so this is something that you guys have to consider. If you yourself have kids and you feel that you can relate to this, then you have to consider your reprimand is not functioning as a punisher. If you're working with clients and you are finding yourself, telling them, no, don't do that, or hey, be careful, and they're like instead going and they're completing the action, or they're continuing to engage in that behavior in the future, then you have to consider that that statement is not functioning as a punisher. Okay. Other examples could be, I put it on the slide, like getting a ticket. When you get a ticket, society thinks that when you get a ticket, you should reduce your behavior of speeding. Let's say it's a speeding ticket. You would ideally stop speeding. Well, the only way to know if that's functioning as punishment for the person is to find out if their behavior of speeding goes down in the future. If it goes down in the future, that's considered punishment. If it does not go down in the future, then it is not an example of punishment. Okay, and that's all it is. So you guys have to make sure that when you are answering questions, when you are looking at real life examples of situations, maybe in the future you're working with a client, don't think about what the person is doing in the traditional sense. Don't think that, the parent is reprimanding the child, that's punishment. No, you have to think about how is that behavior being affected in the future. Okay, that's how I want you guys to analyze examples that you're seeing in questions. That's how I want you guys to analyze situations as you're exposed to them in the real world. So here is the textbook definition for punishment. It is when a response is followed by a stimulus. So a response is followed by a stimulus change that decreases the future frequency of that behavior, of that type of behavior. So it's not just that specific topography, but it could be the similar topographies or behaviors that are in the same response class. Okay, so we're looking at this contingency here. We're looking at this contingency here. Okay, so there's a response. In the example that I gave you guys, it could be my son throws water on the floor, and then the consequence is I reprimanded him. So this is only punishment if that decreases the future frequency of that type of behavior. Okay, so if in the future he stops engaging in the behavior of throwing water on the floor, or if the behavior decreases in frequency, then that is considered punishment. Okay, so let's look at this example that I have here. This is an example that was in your textbook. It was for something similar. So we have the number of bites and pinches per day. I believe it was a little girl that would bite people in her environment pretty frequently. She would bite and pinch them frequently. So during baseline, here we have our baseline, right? During baseline, she would engage in the behavior at a pretty high rate, or frequency. I'm sorry, it says frequency. She would engage in the behavior at a pretty high frequency. So we see here that during baseline, she was ranging between 60 to 90, something 95 more or less. Okay, so this is the level of her behavior more or less. And then they introduced the intervention. So we have our phase change line here. This means that an intervention was introduced. We're starting a new phase. So the intervention was that, I can't recall if it was the teacher or the mom, points a finger at her and tells her no, whenever she would bite and she would pinch. So if she would bite or pinch, she would be reprimanded and be told no. And then what they saw immediately is that there was a reduction in the behavior down to about a range from 20 to 0, or even lower. I would say like 15 to 0, more or less. Okay, so the behavior reduced pretty significantly as soon as the intervention started. And this is something typical that you see with punishment. With punishment, you see a very quick reduction in the behavior. It doesn't mean that it has to go down to 0 right away, but you see a very quick reduction in the behavior, which is different from what we tend to see with extinction, where with extinction, once we start implementing extinction, we see the behavior go up, we have an extinction burst, and then over time it goes down. With punishment, we see a very quick change in the behavior, a very big decrease in the behavior. And then eventually the behavior goes down to 0. So they do a reversal. This is the phase change line, meaning that they're changing phases again. They go back to baseline, where they're no longer going to be reprimanding her. They're no longer going to be telling her no. They're going to be doing the same thing that they used to do during baseline. So here we have a return to baseline. And what they found is when we stop saying no, the behavior goes back up. Okay. So then they implemented a second treatment phase. So we have our phase change lines denoting that a new treatment is coming or is being implemented. So here they start implementing the treatment again. The same thing. They point the finger at her and they tell her no, contingent on her biting, or what was it? Biting and pinching. And then immediately look at how we see a reduction in the behavior. Okay, so this is a good example of functional relation. We can see that when the behavior is, when the intervention is added, the behavior goes down. When the intervention is removed, the behavior goes up. Right, the behavior goes up. And when the intervention is added in again, the behavior goes down. So we have kind of like that light switch type of relationship here. We can turn the behavior on, turn the behavior off. So this is a great example of a functional relation here. Okay, so as you may already know, there are two types of punishment. We have positive punishment, and then we have negative punishment. And again, this should be a review already, but I like to make sure I go over the information and don't like to assume that people know or feel comfortable with the topics. So we'll go over the definitions. Remember that when we are talking about positive and negative and behavior analysis, we're not talking about good or bad, right? I'm not referring to something is good or something is bad. When we are using the terms positive and negative, we are talking about the addition of a stimulus or the removal of a stimulus. So if you hear me say positive, I'm talking about a stimulus that's being added. And if you hear me say negative, I'm talking about a stimulus that's being removed. Okay. So the definition for positive punishment is a stimulus that is added or intensified. Please keep that in mind. A stimulus is that's added or intensified contingent on behavior that results in a decrease in the future probability of that behavior. So what this means is we have our ABC, right? We have our antecedent, behavior, and consequence. So what this means is you engage in a behavior, and some stimulus is added following that behavior. Either the stimulus is added or it's intensified. What ends up happening is it results in a reduction of that behavior. I'm going to give you an example. Let's say that you're washing the dishes. So you're washing the dishes and you turn the knob to the, I don't know, in my house it's to the right. You turn your knob to the right and the water starts coming out very, very hot. And you end up getting burned. Okay, so the stimulus, so I turn my behavior is I turn the knob to the right and this stimulus is intensified. So the water was already, let's say the water was already warm before, right? I turn my knob to the right and the water starts coming out boiling hot. In the future, I'm less likely to then, let's say if in the future my behavior goes down and I'm not likely to turn my knob to the right, as far to the right, then that's an example of positive punishment. Okay, this is an example of a stimulus being intensified. I kind of use that example so you can see what I mean by something being intensified. Okay, positive punishment could also be the example, like it could be, we could use the example that I used in the a few slides before. So where you touch the stove and you end up getting burned, right? And you feel that painful stimulation on your hand. That's an example of positive punishment. So if you consider both of these examples that I just talked about, the stimulus that was added in both of these, the stimuli that were added are aversive stimuli. Okay, so in the first one, it was boiling hot water. And the second one, it was the pain from a hot stove. Okay, so with positive punishment, the stimulus that is added following behavior is usually an aversive stimulus. Okay, another example of this could be a verbal reprimand. Okay, a verbal reprimand following behavior is an aversive, if it is an aversive stimulus, if it makes that behavior go down in the future. In the example that I gave you guys of my son, where I reprimand my son and the behavior does not go down, instead he laughs and he continues to engage in the behavior, that is an example of reinforcement, and it is not an example of punishment. Okay, so again, we need to make sure that we are always looking at what is happening to the future frequency of that behavior. Okay, but if we're talking about positive punishment, then it's the addition of an aversive stimulus, and you guys need to know this. Then we have negative punishment, and negative punishment is when a stimulus is removed or the intensity is reduced, contingent on behavior, and then that results in the decrease in the future probability of that behavior. So we have a behavior. Let me erase this. Hold on. So we have a behavior that you engage in. So we engage in a behavior. Contingent on that behavior, they lose something. So something is removed, or something is like they take something away, right? Something is removed following the behavior that they engage in. And so in the future, the behavior is less likely to occur. If we see a decrease in the future probability of that behavior, then we have an example of a negative punishment. An example of this is, let's say that you arrive late at work, and then you don't get paid as much, right? So you arrived, let's say you arrived 2 hours late to work, and which is a lot. I hope none of you guys are arriving 2 hours late to work, unless you have a good excuse, of course. But let's say that you arrived 2 hours late to work, and then your paycheck is much less. That's an example of negative punishment if your behavior of arriving late to work goes down in the future. Okay. If you arrive late to work and you get less money on your paycheck and your behavior doesn't change, that is not an example of negative punishment. But if your behavior of getting late to work does change because you depend on that money, to survive or whatever it is, then that's an example of negative punishment. The example of the bird eating your sandwich that I gave you guys a few slides ago, that is also an example of negative punishment. So if you walk away from your place at the beach and the bird eats your sandwich, and in the future you're less likely to walk away from your food while you're at the beach, then that's an example of negative punishment. Another example that I want to talk about, which is similar to my verbal reprimand example, there are times when a person, this happens with kids, obviously, but let's say that a child engages in an undesirable behavior, and the parent takes the child out of that environment, and they tell them, okay, you're going to be placed in your room, go to timeout. We have to look at how that behavior is changing in the future, because a lot of times people are implementing what they think is punishment when in fact it's not. Okay, just because you send a kid to their room or to sit on the couch or to, I don't know, face the wall, like looking into the corner, does not necessarily mean that you are implementing punishment. Again, I sound like a broken record, but you have to evaluate what is happening to the future frequency or the future probability of that behavior. There are times when people will send their kids to the room, and guess what they have in their room? In their room, they have their favorite toys, they have a TV, they have their comfy bed, right? And so the child, instead of being sent to an area where they don't have access to preferred items, they are being sent to a room with a ton of preferred items. So what should have served as a punishment in the parent's eyes is instead probably serving as a reinforcer, and then that child continues to engage in the behavior in the future. So, you have to be, there's parameters for each one of these different punishment type procedures, and we're going to talk about how to implement timeout appropriately. But I just kind of wanted to give you guys that example, so as we go through the slides, you're kind of considering things that you've experienced yourself as a child, or maybe, you have a sibling and they have kids and you see how they implement certain things. Maybe you yourself are a parent or you work with kids, right? Think about certain things and how you implement them, how you've experienced them, how you see other people implementing them, and just think about whether the contingencies that are at play are punishment contingencies or not. Okay. So with negative punishment, the stimulus that's removed is usually a desirable stimulus. That's something that you want to keep in mind. So in the example of a bird eating your sandwich, the bird is taking something that you wanted to have, right? You wanted that sandwich. Right, your behavior is really only going to go down if that sandwich was desirable for you, if that sandwich was something that you wanted to continue to access. If you didn't want the sandwich, or you didn't really care for it, you had already eaten enough of it, then it's not likely that you would have cared that the bird ate your sandwich. So we have to really consider, we'll talk about this in a second, but basically motivation plays a role in this procedure. Okay, but the stimulus that's removed is usually a desirable stimulus. Just like being in timeout, for timeout to be effective, the time in environment has to be a valuable environment. The person has to want to be in that environment. I have a client that I worked with many, many, many years ago, and he wouldn't. This kid was probably one of my more severe clients. He would engage in aggression in the classroom, pretty severe aggression. He would engage in property destruction. He would throw chairs, throw bottles, whatever. He would do, it was a lot of different typographies that he would engage in. And when I first started working with him, I did an indirect assessment. I got information from the teachers, from other school staff about how they were managing his behaviors, kind of what the concerns were, what was going on, why did they need intervention in the school setting. And one of the things that was really alarming to me, but it shouldn't be so alarming to me because it happens very often, more often than you would think, was that when he would engage in all of these severe instances of problem behavior, of aggression, of property destruction, he would get sent to the classroom next door, which was a classroom, it was like a grade below his grade. And the teacher in that classroom would put him on the computer. So he would go from this setting where he was expected to work, expected to sit, expected to, act in a particular way, play nicely with peers, share with peers. He was going from this very demanding setting to a setting that was less demanding. And not only was it less demanding, but the teacher was providing him access to a highly, highly preferred item contingent on him engaging in all of these severe forms of problem behavior. So obviously, in the eyes of the school staff, they were punishing him. They thought that this was a form of punishment. The teacher would threaten. This was I think this was a really good teacher. Obviously, she doesn't have like a behavioral background, so I'm not bashing the teacher here. She was a very sweet and supportive teacher. But the teacher would say to him, if you can't calm down, I'm going to send you to the classroom next door. And to him, that was like, oh my goodness, I want to go to the classroom next door. Please send me to the next, to that classroom, because there I get to play on the computer. And so, this is an example of people thinking that they're implementing punishment, but really misusing or misapplying punishment, and not having an understanding of what punishment truly is. And that's okay. Behavior analysis is not common knowledge. I wish it was more, I wish people knew more about behavior analysis, because then they could implement more effective treatments. They could work with children more effectively, or with individuals more effectively. but that's what we're here for. That's what our jobs are. What your jobs will be in the future is to be able to support people in an appropriate way. Okay, so let's keep going, and we'll talk about some of the different punishment strategies in the next few slides. Actually, before we jump into talking about all of those other punishment related topics that I mentioned, let's talk about threats. I did mention threats just a little while ago, about how a teacher would say, the teacher, and with this specific client of mine, she would say, if you keep on doing X, Y, and Z, I'm going to send you to next door. And I mentioned how that is not an example of punishment. Well, threats in general, not just that example that I gave you guys, but threats in general are actually not the same as punishment and should not be confused with punishment, okay? Threatening a person, if you guys remember, I mentioned to you guys that punishment is a response, consequence contingency, okay? So we have to look at the behavior and then the consequence that follows, right? What's that consequence that follows? And then how does the behavior change in the future in order to understand if it's a punishment, if punishment is occurring. Whereas with threats, there is no contact with the behavior never occurs with the threat, right? Like there's no contact of the behavior occurring and then a consequence following. A threat is an antecedent event. It's something that's occurring prior to behavior. So the teacher that's saying, if you engage in X, Y, and Z behavior, you're going to be sent to the classroom next door. That's an antecedent event, okay? That is not an example of it could be an EO or an antecedent. That is not an example of a behavior and consequence relationship, so it's not punishment, okay? Behaviors, though, if you consider threats that you've experienced in your own lives, behavior can be suppressed because of a threat. So if a person tells you, if you, let me think of an example. If you hit your sister, then you're not going to watch TV. That's an example of a threat. And threats do function to reduce behavior, not reduce, but they do function to suppress behavior, right? To get behavior to not occur. And if you think about what we talked about last week with regards to negative reinforcement, with negative reinforcement, there's usually some like aversive antecedent that the person is exposed to, or some EO to avoid some behavior, some stimulus, So there's usually some aversive stimulus that's present, and the individual wants to avoid coming into contact with that particular stimulus. So that is actually what a threat is. If a threat functions to suppress behavior, then that means that threat is functioning as an establishing operation, just like it is in negative reinforcement. Okay, so it's functioning as an establishing operation, signaling that some worsening condition is coming or some aversive stimulus is coming. And so the person does not engage in that behavior that is specifically being outlined in the threat, simply because they want to avoid coming into contact with that contingency that's being described in the threat. All right, so now let's talk about types of punishers. If you guys recall, you should be familiar with the term punisher already, but just in case, we'll review. There are positive reinforcers and there are negative reinforcers. Well, just the same as there are reinforcers, we also have punishers. And punishers are those stimuli that are presented following behavior that result in a decrease of that behavior, okay? But the punisher is the stimulus that's being presented following the behavior. So in that A, B, and C contingency, it's that consequence, okay? In behavior analysis, I guess you might see the term being used, the negative punisher being used, but it's not often that you'll hear the term negative punisher, because negative punisher really just means that you are removing a positive reinforcer, okay? Remember that I told you guys that with negative punishment, we have the removal of a desirable stimulus or of a stimulus that a person wants to continue engaging with. It's really the removal of positive reinforcer. So we don't really use the term negative reinforcer very often. It's not to say that you won't see it at all, but I'm sorry, negative punisher very often. It's not to say you won't see it at all, but it's not very likely you will. So generally, when you hear the word punisher in behavior analysis, people tend to be referring to a positive punisher. So this is an example of this would be like painful stimulation, getting a ticket. Trying to think of some of the examples that I talked about earlier. The reprimand. Okay, those are some examples of positive punishers. Okay, and then we also have our conditioned versus our unconditioned punishers. And these are, again, you've heard me talk about conditioned and unconditioned very frequently in this course, and you should have already heard it also in your intro to EAB course. So conditioned in behavior analysis refers to something that's been learned or acquired, and then unconditioned is something that is unlearned. Okay, so if we have an unconditioned punisher, we're referring to those punishers that are those stimuli that are innately punishing. Okay, they serve as punishing stimuli. This could be something like pain, something that's extremely hot, like a foul smell, right? Things like that like just from birth tend to be punishing stimuli. Whereas we have our conditioned punishers, and this is something like being reprimanded. Getting a ticket is a conditioned punisher. Those are things that over time, through pairing with other aversive stimuli, they've become a punisher themselves. But originally, these were stimuli that were probably neutral stimuli, right? For my young son, getting a ticket means nothing to him. Whereas maybe as a 15 or 16-year-old, when he's driving in the future, getting a ticket might serve as a punisher. I would hope. Hopefully he doesn't come into contact with that contingency, but if he does, then I hope it serves as a punisher where it'll reduce whatever behavior that he was engaging in. Okay, so these are stimuli that over time need to be paired with other punishing stimuli in order for them to acquire the punishing effect. Okay, and then finally we have generalized conditioned punishers, and these are stimuli that serve to punish a lot of different behaviors, and it's been paired with a lot of other different conditioned and unconditioned punishers. Okay, so an example of a generalized conditioned punisher would be no, like someone reprimanding you and saying no. Someone pointing their finger at you might be a generalized conditioned punisher. A parent like shaking their head at you and saying no, shaking their head no might be considered a conditioned punisher. And then this one, which I'm sure a lot of you are familiar with, maybe not everyone, but the eye glare, the mom stare, right? This serves as, for a lot of people, a conditioned punisher, where when you were younger, maybe your parent just had to open their eyes at you very big and give you like the mom or the dad stare, and you would immediately stop doing what you were doing. Okay, this is an example of a generalized conditioned punisher. Now let's talk about some punishment examples and the discriminative effects of punishment. So if you recall in the lecture of reinforcement and also some content that you covered in your introductory course, your intro to EAB course, you probably will remember that there is something called an SD, or discriminative stimulus. And the discriminative stimulus is a stimulus that signals the availability of reinforcement. So what this means is it signals that if you were to engage in behavior when that stimulus is available, or when that stimulus is in your presence, then you will gain access to reinforcement. Okay, so it signals that reinforcement is available. Well, similarly to how we have that discriminative stimulus for reinforcement, which tells us reinforcement is available if you were to respond now, we also have a discriminative stimulus for punishment. So we're going to talk about that now. I'm going to start off this part of the lecture by talking about an example. a punishment example. So pretend that you get pulled over for speeding in the town of Miami Lakes. I'm sure some of you guys are familiar with the town of Miami Lakes. If you're not, it's a town that we have here, or a city that we have here in South Florida. And at least growing up, I always thought, you know, in Miami Lakes, I always see a bunch of cops. I wouldn't want to speed here. And then when I began driving, I would always make sure I would drive slowly in the town of Miami Lakes. This is an example of me discriminating based off of a stimulus that I am coming into contact with, because that stimulus has some history of punishment attached with it. Okay, so let's say that I get pulled over in the town of Miami Lakes for speeding. Well, in the future, what's going to happen to my behavior? Let's see. In the future, I'm probably going to be less likely to speed through the town of Miami Lakes, simply because I know that there has been police in that area, or I have created an association based off of my history of reinforcement or history of punishment, that in that area, if I speed, I'm likely to contact, like getting pulled over by a cop, maybe get a speeding ticket, whatever it might be. So I am less likely to engage in that behavior in the town of Miami Lakes, but maybe in another city where I haven't seen as many police, then I am more likely to speed. Okay, so this means that the town of Miami Lakes serves as an SDP for me. So what this means, an SDP is a discriminative stimulus for punishment. So just as we have discriminative stimuli for reinforcement, right, that signal the availability of reinforcement, we have discriminative stimuli that signal that punishment is going to happen if you engage in that particular response, right? So an SDP is a stimulus condition in the presence of which a response has a lower probability of occurring due to a history of typically preceding punishment, or typically being associated with punishment for engaging in that response. Okay. So on this slide, you can see what that relationship or that contingency looks like. So on the first row here, we have the discriminative stimulus, which in this case, the discriminative stimulus is an SDP, right? It's a stimulus that signals punishment is going to occur if you engage in the particular response that has been associated with punisher in the past. So this is that response consequence contingency that has been associated with punishment. So we have the antecedent, which is the SDP. If you engage in the response in the presence of this antecedent, then you are likely to come into contact with the consequence, which is a punisher, okay, or an SP. So in this case, SP signals is denoting punisher. That's what that means. So when you see SP, you should be thinking of the term punisher. And just, well, I'll go over the difference between the term punishment and punisher, because I know that that's been a little bit confusing for some of you guys. So I want to make sure that I do go over that a little bit more, just so that in these examples, just so that you feel confident and comfortable discriminating between those two terms. Okay, so let's talk about this example here. So in this example, we have a grandma in the kitchen before dinner. That's the SDP. So the response is reaching into the jar and reaching into a cookie jar. So if you reach into a cookie jar, your grandma scolds you. Okay. In the future, the frequency of that behavior or similar responses is going to go down in the presence of grandma being in the kitchen. So what happens is, because you have a history of reaching into the cookie jar in the presence of grandma, grandma ends up scolding you. So what happens is, in the future, when you are in the kitchen with grandma, or you see grandma in the kitchen before dinner, then you are less likely to reach into the cookie jar, because you know that reaching into the cookie jar in the presence of grandma before dinner is going to result in you getting scolded. Okay, so in this example, the whole contingency is a punishment contingency. This whole thing, right? This whole thing is a punishment contingency. And it's a punishment contingency because it results in the reduction of the future probability of behavior. And then the punisher is the grandma scolding. So the punisher is always going to be the stimulus change that follows behavior. It's always the the consequence that's being delivered following behavior. Just like a reinforcer is the consequence that's delivered following behavior, well, a punisher is a consequence that's delivered following behavior that results in a decrease in the future probability of that behavior. Okay, so I hope that helps to clarify the difference between punisher versus punishment. Let's look at another example. You are at the beach having a picnic, and then there's seagulls present. You leave your sandwich unattended, and then the seagulls fly away with your sandwich. In the future, you're probably less likely to leave your sandwich unattended because you've come into contact with the contingency that the seagull will fly away with your sandwich. So in the future, when you are in the presence of seagulls at the beach and you're having a picnic, you are not likely to walk away from your sandwich and leave it unattended. Okay, so this seagull being present at the beach becomes a discriminative stimulus, an SDP, a discriminative stimulus for punishment, which is going to signal that if you engage in these particular responses, you are going to contact punishment. So what's going to happen is, in the presence of the stimulus, you are less likely to engage in these behaviors in the future. So again, the antecedent in a punishment contingency is called an SDP. It's a discriminative stimulus for punishment. And then the reinforcer is going to be denoted as an SP, or a stimulus for punishment. Okay, so as you know, punishment has the effect of reducing a person's behavior, reducing the frequency of the behavior, the intensity of the behavior. It has suppressive effects on behavior, but these effects on behavior are not permanent. Contrary to what people believe, right? People believe that if I punish a particular behavior, it's going to go down forever. No, that's not the case. You have to upkeep punishment just as you would for reinforcement in order for that behavior to maintain at the level that you want it to maintain. Okay, so this is important to know for different reasons. There are behaviors that have been punished in some settings that you wouldn't have wanted to be punished, right? Maybe a person was exposed to traumatic experience when they were children. You know, the parent maybe didn't want them speaking and would constantly tell them to be quiet. And you don't want that to maybe be occurring in their adult life. So it's good to know that the effects from punishment are not permanent, right? Because then that person would never speak in other settings. It's something still that they have to maybe, work against. They still have to get reinforcement for speaking in other contexts in order for that behavior to start occurring again. But it's good to know that those suppressive effects are not permanent. Okay, so this is in the case of misuse of punishment, of course. There are instances when we want punishment to maintain. We want those suppressive effects to maintain. And so that means that we have to keep up our schedule of punishment. You have to make sure that you are being consistent with your delivery of punishment and not being inconsistent. So recovery from punishment can happen and is more likely to happen when a behavior that has been punished is also obtaining reinforcement. This is something that you need to keep in mind. Whether you are trying to maintain a behavior that has been punished, you want it to continue to be suppressed, then you need to look at if there are other instances in which it's being reinforced or contacting reinforcement. Because if it is, then it's likely that person will start engaging in that behavior again because that behavior is being intermittently reinforced. And then recovery from punishment or recovery of responding to a pre-punished level is more likely to also occur when the punishment was mild and when the person can discriminate that the punishment contingency is no longer active. Okay, so what this means is that a person is likely to start engaging in that behavior again if the punishment that was being delivered was very mild. So if it's not a punishment that's strong enough to suppress the behavior, then the behavior will start occurring again. And then also if the individual is able to discriminate that they are no longer going to be exposed to that punishment contingency, then they'll begin engaging in the behavior again. An example of this is, at a workplace, when a boss walks in, you might learn to stop engaging in particular behaviors in the presence of your boss. This is an example of your boss functioning as an SDP, as a discriminative stimulus for punishment. So in the presence of your boss, you're not likely to engage in the behavior, but when your boss leaves, guess what? That punishment contingency is no longer active. So there are people that act differently in the presence of their boss than they do in the presence and in the absence of their boss. So if you are acting differently in the presence of your boss versus in the absence of your boss, and this is an example of your behavior going down to pre-punished levels in the absence of that SDP. So if the person can discriminate that the punishment contingency is no longer active, then their behavior will come back to pre-punished levels. So you'll see recovery of responding. Okay, so now let's talk about factors that influence the effectiveness of punishment. So these factors that we're going to go over are things that you want to consider when you're implementing punishment to make sure that your punishment is as effective as possible. So the first one says immediacy of punisher. Basically, we want the punisher to be delivered as closely as possible to when the behavior occurs. So this is the same thing for reinforcement. You know, the proximity to which you are delivering that punisher is very important. The temporal proximity, right? So as closely as possible to the behavior. So if the behavior occurs, immediately you should be delivering the punisher. And you don't have to wait for the entire behavior to occur, right? Like let's say it's a long behavior chain that involves many different steps. You can immediately punish the behavior as soon as that first step in the chain occurs, or if you can tell that the person is going to engage in the behavior, as soon as you can anticipate that, once they start engaging in that first step of the behavior, then you would go ahead and deliver the punisher in order to suppress the behavior in the future. Also, there have been studies that have been conducted where they show that even delays as little as 10 or 30 seconds after the behavior occurs, where you're delivering the punisher 10 to 30 seconds after the behavior occurs, tends to diminish the effects of punishment. This is the same for reinforcement. With reinforcement, you have to deliver the reinforcer immediately following behavior. The immediacy of the reinforcer is very important, because if you don't deliver reinforcement immediately following that behavior, what happens is we might inadvertently be reinforcing a different behavior. The same applies for punishment. If we don't immediately apply the punisher, we might inadvertently be punishing a completely different response. And so we want to make sure that the punisher is delivered as closely as possible to the behavior occurring. There's something that your textbook suggests to mitigate the effects of not being able to possibly punish a behavior immediately after. Of course, you know, we're all busy. There's completely different dynamics in every single setting that you work in. And so there will be situations where immediately punishing a behavior might not be possible. Let's say, for example, that you have a client that engages in fecal smearing. This is a thing, right? This is like a legitimate thing. I've never worked on this behavior myself, but I've worked at clinics where they've had clients that engage in these behaviors. If you have a client that engages in fecal smearing, the child could be in the bathroom very well, engaging in this behavior for 5 minutes straight, and you're not able to you're not able to deliver the punisher immediately following the behavior because you don't have access to the client in that environment. You only have access to knowing that the individual engaged in that behavior after they've left the bathroom and you've gone into the bathroom and seen, you know, the product of their behavior. So you see the feces all over the walls or on the floor, wherever it is, right? So the immediacy of the punisher, right, immediately delivering the punisher might not always be possible, like in the example that I just gave you. So then you have to try to come up with a product that signifies that this is like the behavior that's being punished. Okay, so the textbook suggests, if possible, recording an individual when they're engaging in a behavior in order to then maybe show them the behavior that they're being punished for when you're showing them the punisher. When you're delivering the punisher. So that, you know, I personally feel that the ethics of that is a little, you know, cloudy. I personally wouldn't do something like that. But I'm sure there's research out there that that maybe would provide better practices for doing something like that. I personally have never had to implement something like that, and if I did, then I would probably do some more research to see what are some more ethical practices, or what's a better way to approach that, to be able to deliver a punisher more immediately. The next factor that we want to consider is the intensity of the punishment. The intensity of the punishment, again, is going to be a factor that is going to play a role in how effective our punishment is or is not. Most people tend to think that we should start off with a smaller punisher, maybe just like a simple verbal reprimand, in order to see if that works, and then they'll go to a more, when that doesn't work, they'll go into a more difficult punisher. Sorry, not a more difficult punisher, but a more intense punisher. So instead of just a verbal reprimand, like, no, don't do that, they'll be like, Johnny, didn't I say not to do that? Sorry for those of you wearing headphones. I hope that wasn't too loud. And then when that doesn't work, they'll move on into a more intense punisher. Johnny, didn't I say not to do that? Why are you hitting your sister? And then they'll be like, go sit down in the chair. And then when that's not effective, then they move into a more, intense punisher. But the research does not support the gradual increase in the intensity of the punisher. Instead, they recommend that you start off with that high intensity punisher or that high intensity stimulus that's going to be effective from the get-go. And that obviously that high intensity stimulus, you don't want it to be something that's unethical or that's going to harm the individual, but you want it to be something that as soon as you implement it, it's going to be effective in suppressing the behavior. And the reason that you don't want to gradually increase the intensity of the punisher is because you don't want the individual to become habituated to the punishers that you're exposing them to. So for example, in the example that I gave, a mild verbal reprimand, the child learns, okay, I didn't listen to that. I don't have to listen to what this person says. And then the person moves into a more gradual, a gradually more intense a verbal reprimand, where maybe they're being more stern in the way that they say it. And that child learns, okay, I still don't have to listen to you. This isn't that bad. What you're telling me is not that bad. So then you gradually increase more. And then what you're basically doing is you're teaching the individual to habituate to those gradually more intensive stimuli, punishing stimuli. Whereas if you had just from the get-go, used timeout, that probably would have been most effective, and you would have been able to immediately punish the behavior as soon as the behavior occurred. Okay, so you want to have a high intensity stimulus that's going to be effective, but you don't want to have something that is more intense than it needs to be. Okay. Now let's talk about the schedule and the consistency of punishment. Okay, before we talk about the punishment schedule, let's talk about the continuous reinforcement schedules. If you guys recall from the lecture on reinforcement, continuous reinforcement schedules are used to acquire new behaviors. Okay, so when you want to teach a brand new skill, you should reinforce the skill after every single instance of the behavior occurring. This is going to strengthen the response, right? It teaches a person to anticipate exactly what consequence is going to follow the behavior. Well, similarly, when we are implementing punishment, we want to deliver the consequence after every single instance of the behavior. We want the person to be able to anticipate that if I engage in this problem behavior, this punishment is going to follow. Okay, by creating consistency, we are able to have a more suppressive effect on behavior. The behavior will reduce more quickly, and we'll be able to keep the behavior down for longer. Now, if you move into an intermittent schedule of punishment, meaning that you are not punishing the behavior after every single instance of behavior, then you cannot guarantee that behavior is going to be suppressed. There are some instances, and if you gradually thin the schedule of punishment, meaning that if you go from continuously delivering punishment after every single instance of the behavior to sometimes delivering it and sometimes not delivering it, if you do that, let's say, like a very gradual fading of that schedule, then it's possible you can still maintain the suppressive effects of punishment, meaning that you can keep the behavior down. But you have to be very cautious, because intermittent punishment is not like intermittent reinforcement, right? Intermittent reinforcement, we usually try to move to an intermittent schedule of reinforcement to maintain behaviors because the unpredictable, because it's so unpredictable, the person continues to engage in the behavior because they don't know when reinforcement is coming. It's not the same for punishment. For punishment, if you move to an intermittent punishment schedule, since the person doesn't know when the punishment is coming, sometimes they think, okay, well, I'll be able to get away with the behavior, and they're still going to contact the contingency of reinforcement. If you're on an intermittent punishment schedule, then that means that you're also on an intermittent reinforcement schedule. That's kind of like a complex thought, but if you're not punishing the behavior after every single instance of the behavior, then that means that the behavior is occasionally coming into contact with reinforcement, meaning that the behavior is also on an intermittent reinforcement schedule. Okay. So as much as possible, you want to maintain a continuous punishment schedule in order to suppress the behavior. Okay. I'm going to give you a personal example. I very rarely, honestly, I don't know if I've mentioned this, but I very rarely have had to implement punishment or add punishment as a procedure in any of my treatment plans. I think, in the years that I've been in the field, I maybe have had 3 clients or 4 clients that I've ever used punishment for. And it's really been after exhausting many other options of interventions. I've tried more reinforcement-based interventions, but anyways, there was this one client that I was working with where we had a punishment procedure in place for him for a particular behavior that he would engage in at school. And the therapists were instructed to remove a token after every single instance of his problem behavior. And they did a really, really good job with implementing the intervention. And the intervention was so effective that within, a day or two, the behavior had gone down, and this child was able to be able to integrate himself more into the classroom. He was sitting more, he was attending more, he wasn't engaging in disruptive behavior anymore, right? He was actually gaining some value from this setting because we were able to suppress this problem behavior. We were able to reduce this problem behavior. But after a while, his rate of problem behavior was so low that the therapist started to be, feel bad for implementing the punishment procedure, which, mind you, it's a very mild punishment procedure, but strong enough to still reduce the behavior. It was just the removal of a token from a token board. That's all it was. And they started to feel bad after some time to implement the procedure because his rate of problem behavior was so low at that point that they didn't deliver the punishment. And instead they placed his behavior, on an intermittent schedule of punishment without me knowing. I noticed after some time that I would go observe them and they weren't implementing the intervention. But what started to happen was the behavior started to come back, meaning the behavior was recovering from punishment. Okay. Like I said, if you're not punishing the behavior, then that behavior is contacting reinforcement. So that behavior is going to start to come back. It's going to start to increase in frequency and rate again. So inadvertently, these therapists ended up, not delivering the punishment procedure, and instead the behavior contacted reinforcement, and we had to again, manage the behavior or like implement the punishment procedure all over again, like with a very high rate of behavior again, because the behavior ended up recovering and coming back to baseline levels. So again, we had to implement the punishment procedure very consistently, and I talked to them about the importance of consistently implementing the punishment procedure and delivering it after every single instance of the behavior. And then they, of course, at that point, they realized, they realize the importance of delivering the punishment procedure continuously. Okay, so although you might feel bad about delivering that punishment procedure, after some time, maybe after the behavior goes down to lower levels, you have to consider why you even started targeting that behavior to begin with. Was it a problematic behavior? Was it not allowing that person to access reinforcement in their environment? Was it a dangerous behavior? Was it hazardous to other people, right? Consider what the social significance of you even having targeted that behavior in the beginning was, okay? So that you can maintain, it can kind of help you to maintain that contingency continuously. And this last point on here is the point that I just made to you guys, is that reinforcement for target behavior is occurring if the behavior is continuing to occur, right? So if that behavior is being maintained in the environment, right? If that behavior is even occurring at low rates, then that means that some way, somehow, that behavior is contacting reinforcement. That's the point that I was trying to make to you guys earlier. If you don't have the behavior on a continuous punishment schedule and you have it on an intermittent punishment schedule, then that means that on the moments in which you're not delivering the punisher, then that behavior is coming into contact with reinforcement, meaning that behavior is on an intermittent reinforcement schedule, which we know is the schedule that is most likely to maintain behavior over time. Okay, so that's not what we want. We want to have as consistent of a schedule as possible. We want that schedule to be continuous punishment as much as possible within the parameters that we can obviously, that would allow for something like that. So this goes to say that as much as possible, we would like to reduce the amount of reinforcement that's being delivered for that behavior, okay, in order for punishment to be more effective. So if you want the punishment procedure to be effective, you have to find ways to reduce the quality of reinforcement, or just reduce reinforcement altogether for the behavior, the target behavior. And then you also want to make sure that you are identifying other behaviors, alternative behaviors that this individual can engage in that maybe serve the similar function or the same function in order to contact reinforcement for these alternative behaviors. Okay, so you want to teach and reinforce appropriate alternative behaviors in order for those alternative behaviors to go up and the problem behavior to go down. Okay, so now let's look at some of the possible side effects and problems that might occur with punishment. Okay, I'm sure that some of you have experienced this, and so some of these possible side effects of punishment might be more obvious, but we're going to go over some that might be less obvious. Okay, so when you implement a punishment procedure, you should expect that there will be some emotional and aggressive reactions. And some of these reactions can be either respondent behaviors, or some of them might be operant behaviors. So when you implement, let's say, a positive punishment procedure, maybe that includes something like painful stimulation. Some of you guys have, like, I'm sure you've seen the shock collars for dogs when they engage in like an undesirable behavior. The dog owners will shock them. You can expect that in some of those instances, in response to pain, that will elicit some aggressive reaction from the dog. Okay, this is an example of a reflexive behavior. It's respondent behavior. It is not under any operant control. Instead, it is a response to that painful stimulus that then elicits that maybe emotional or aggressive reaction. Okay, it'll happen across species. You can expect these types of reactions across species. It's not going to happen in every single instance of a punishment procedure being implemented, but it's most likely to happen with positive punishment procedures. So positive punishment procedures are more likely to elicit some aggressive reactions in the individual that it's being implemented on. You can also expect that operant aggression might occur, which is when a person engages in aggression following punishment because they've learned that through engaging in that aggression, it's going to result in some escape from the punishment contingency or some avoidance of the punishment contingency. So that's also something that you should be aware of when you're implementing a punishment protocol, is that it's going to result possibly, not in all cases, but it will possibly result in some emotional and aggressive reactions. And so you want to consider the ethics of that. You also want to make sure that whoever is in your environment that is implementing the punishment procedure, or maybe that is around while implementing the punishment procedure, is aware of the possible side effects of punishment, and that it's something that they're able to I guess accept, and that they're able to work through. Okay, just because a person engages in an aggressive reaction in response to punishment, or an emotional reaction in response to punishment, does not mean that you're going to ignore them, right? We should still be providing, comfort to our clients depending on the function of the behavior, of course. But like we're humans, and we don't want to be inhumane when delivering punishment procedures. At the end of the day, we're just trying to reduce a behavior in order to improve the quality of the life of the individual. We're not trying to teach the individual that they are not valued, that they should be ignored, right? Those are not things that we want to teach them. We're focused on reducing the behavior, and some of these other side effects of punishment are effects that we want to be very considerate of and very compassionate, I guess address in a very compassionate way when they do occur. Something that you also want to keep in mind when you are implementing a punishment procedure is that because the punishment procedure is an aversive stimulus, the person's going to want to escape or avoid that stimulus. They're not going to want to come into contact with the punishment procedure, and so they might engage in behavior to avoid or to escape those stimuli that are being delivered following their problem behavior. That also might inadvertently teach some behaviors that are even worse than the target problem behavior that you were addressing, right? So if a person knows a punishment procedure is going to be delivered for having engaged in a particular problem behavior, they might learn to lie or to hide certain things from you in order to avoid being punished. So if you want to minimize or prevent this effect of escape and avoidance, then one thing that you can do is, like I said in one of the previous slides, is teach an appropriate alternative response, right? You have your problem behavior that you are reducing and that you're going to be delivering the punishment contingency for, but they should have another alternative behavior that is desirable and that they can contact reinforcement for. So instead of them engaging in that problem behavior, they have this alternative behavior that they can engage in that will allow them to contact reinforcement. So whenever possible, if you are trying to minimize or prevent the effect of escape and avoidance, then you should also have an alternative response that you're teaching that individual in order for them to contact reinforcement. Because what will happen is they'll be more likely to engage in that alternative behavior than to engage in that problem behavior that's going to result in punishment. Now let's look at the possible side effect of behavioral contrast, okay? And you may recall or may not, so I'll make sure I go over the definition of behavioral contrast with you. But behavioral contrast is when you have behavior that's reinforced in different settings or in different contexts. And those behaviors that are reinforced in different contexts, each are under different schedules of reinforcement. This is called a multiple schedule. Okay, and behavioral contrast occurs when you change the schedule of reinforcement in one setting and you don't change it in the other setting. So what ends up happening is the behavior let's say that you reduce the behavior in one setting, you're going to have the opposite effect in the other setting. So if I make a change at let's say at school, then I can expect the opposite to occur at home if I don't change what's going on at home. So let's look at what this looks like on the next few slides. So let's say that you have a problem behavior, throwing, okay, which throwing occurs both at school and at home, and it occurs at similar rates in these two settings, okay? But then we decide that we're going to punish throwing at school, and we don't do anything at home. At home, it remains unchanged. The parents continue doing whatever they were originally doing. But at school, the teachers are going to be punishing the behavior of throwing. So what's going to happen at school is that the behavior is going to go down. Okay, so we're going to get a reduction in the behavior at school due to the punishment procedure. And what's going to happen at home is not that it's going to stay at the same level that it was occurring at before. Instead, what's going to happen is the behavior at home is going to increase. So you're going to see an opposite effect in the alternative setting. So because we reduced it at home, because we reduced the behavior at school, at home now we're going to see the opposite effect. We're going to see the behavior increase because this is a behavior that still needs to be satisfied. It has a function to satisfy. So behavioral contrast basically says that if we change one component of a multiple schedule, so if we reduce let's say the behavior in one setting, what's going to happen in the opposite setting is that we're going to see a change in the response rate in the opposite direction. So this was the setting sorry, you don't see the pointer. This was a setting that did not change. The schedule did not change, right? So instead what's going to happen is the behavior is going to go up. We're going to see an opposite effect to what was changed. So instead, what we want to do to reduce the effect of behavioral contrast is that we want to intervene on the behavior across all settings or across all stimulus conditions. Okay, so if the behavior is occurring at school and at home, then we need to punish the behavior both at school and both at home. It cannot be that we address the behavior only in one context, because by addressing the behavior in only one context, we're going to have the effect that you just saw on the previous slide, which is that the behavior is going to go down in the context in which you're punishing the behavior. And then in the setting in which you're not punishing the behavior is going to go up. That's what we call behavioral contrast, okay? So just try to keep that in mind. This is an important concept that you do need to know, because you will be tested on this, not just in my course or in future courses, but it's going to come out on the BCABA exam. Well, everything that we talk about in all of these courses is fair game for the BCABA exam, but it's a concept that, you know, I think people sometimes overlook. So you want to make sure that you understand this concept of behavioral contrast. Next, we want to consider that a potential unwanted problem with punishment is that by implementing punishment, you are also modeling inappropriate behavior for that individual, or undesirable behavior for that individual, right? So like, let's say that some people use spanking as a form of punishment. We don't do that ourselves in this field. Like, this is not something that you would use as a practitioner. You're not going to spank your clients. But a parent that uses that uses spanking as a form of punishment is modeling undesirable behavior for that individual, which it's then possible for that child to then go to school and start hitting other children. And we wonder, oh, well, why is he hitting other children? Like, where is this coming from? Well, it's possible that the parent modeled that behavior for them, and then that's where they're learning it from. Okay, so you have to consider that punishment, when you're implementing punishment, you are also implementing possibly a harsh treatment or a negative interaction that then that individual might go on to imitate. So you just have to be considerate of that. By the way, I just want to kind of reiterate, we don't spank people in our field. I'm just like analyzing, you know, what a possible punishment procedure that a parent might implement, you know, maybe prior to ABA treatment. And I'm just analyzing the effects of those punishment procedures, right? There's tons of punishment procedures that we will come into contact with in our lives. You might have a boss that scolds you, or a boss that yells at you. That's a form of punishment if it's reducing your behavior. It's not I guess like a sound punishment procedure, or a punishment procedure that would be very ethical or that you would recommend. It is sound. It's an effective punishment procedure, but it's not one that we would recommend as ABA practitioners. But it is an effective procedure that people engage in naturally. So I just wanted to reiterate that point. Another factor that you want to consider when you are implementing punishment is that punishment is negatively reinforcing to the person that's implementing punishment. And I'll break that down a little bit so that you guys can understand what I mean. But think about all the examples I've given you so far are like from the perspective of the person that engages in the problem behavior. So a person engages in problem behavior, and then we deliver a punisher. Well, I want you to switch perspectives now. Switch perspectives to the person that's implementing the punishment. So to the person that's delivering the punishment. Think about what their behavior is. Let's say that their behavior is them delivering the punisher. And what happens to what's the consequence that's delivered? When they deliver the punisher, the consequence is that the client's behavior goes down, or their child's behavior goes down in the future. So if you think about it, their behavior is getting negatively reinforced. So we have to be very cautious, because if the person that's implementing the punishment, if their behavior is being negatively reinforced, then they might be more likely or more inclined to want to use punishment in the future, which leads us to the risk of the overuse of punishment, the potential risk of the overuse of punishment. So an example of this is, let's say that a parent yells at their kids, And the consequence is that the kids stop yelling. The kids stop engaging in the problem behavior, whatever that problem behavior was. So because the kids stopped engaging in the problem behavior, the parent's going to realize, well, when I yell at them, they stop engaging in whatever problem behavior they're engaging in, so I'm going to yell at them more often in the future. And this is a problem because that parent has learned that through yelling at my children, I can get them to stop engaging in problem behavior. So that parent is now overusing punishment simply because it's effective, and it negatively reinforces the parent's behavior. So they're not maybe trying alternative interventions that are more positive or that will lead to more positive interactions with the children. They're not implementing interventions that teach appropriate alternative responses. Instead, they're resorting to punishment because punishment is effective. By definition, punishment is effective, and because punishment is negatively reinforcing for the person that's delivering the punishment procedure. So we have to be very, very cautious when we're implementing punishment to keep, this is just something that you want to keep in mind, right? The possible unwanted effect of punishment being overused because it's negatively reinforcing. So when you implement punishment procedures in the future with your clients, if you have to, this should not be something that you're resorting to immediately. This should be like a last resort type of thing, or like if it's a severe problem behavior, then you might want to implement it immediately because maybe the behavior causes more harm to the child than the punishment procedure does. But you want to be considerate of this side effect in the future when you're implementing punishment so that you don't overuse punishment with your clients. Okay? I have had an instance myself in which I have had to use punishment with a client. We use a timeout procedure. And prior to having implemented that timeout procedure, I had months worth of interventions that were ineffective. I had months worth of reinforcement-based interventions that had been ineffective. And finally, after trying all of these interventions, I was like, okay, you know what? We've exhausted all of these positive or reinforcement-based interventions. Let me try punishment intervention. And the punishment intervention was effective immediately. So what I had spent months trying to intervene on, it only took a few days to reduce by using punishment. So I had to think to myself, I remember thinking to myself, wow, this punishment was so effective. If only I had used this from the beginning. But ethically, that's not correct. And it's not a good thought process to have because that's how we get into the habit of overusing punishment. So when you are going to implement punishment in the future, be mindful of the fact that punishment is reinforcing for the person implementing it. Like the example that I just gave you, of myself. And I had to really, it was an interesting thought to have because I was like, wow, I if only I had done this from the beginning, right? Because it would have saved so much more time. It would have been a lot easier for all of the different reasons, but ethically, it's not the correct thing to do. Okay, so as a practitioner, it's important to know that this is a potential side effect of using punishment and to keep this in mind when you are implementing it in the future so that you do not inadvertently overuse punishment with any of your clients. You should not be resorting to punishment first. You should be, and this comes with exceptions, right? There's times where punishment is necessary, like I said, in cases of severe self-injurious behavior, severe aggression, right? When the behavior is more harmful to the individual or other people around, right? Like the risk of the behavior is so high, then there are instances when using punishment first is called for. But in most instances, you need to exhaust reinforcement-based interventions first. And then if those don't work, then you can attempt punishment interventions. But you should not, in most cases, if the behavior is not like an extreme behavior or a very severe behavior, then in most cases you should be looking at implementing reinforcement-based interventions first. Okay, so now we're going to jump into the topic of positive punishment interventions. Okay. I'm going to be using the slides that come from your textbook or the publisher created slides for this particular section because they do provide more information, and I want you guys to have as much information on these different topics. But just remember that when you are, when we do cover the different positive punishment interventions, that you also have other resources available to you. So the information that's going to be available to you on this slide is not, on this presentation, is not all that you should be exposing yourself to in terms of these interventions. You should still be reading your textbook. If you have articles, you should be looking at articles pertaining to different positive punishment procedures. You should still be learning more about positive punishment interventions, and not just the limited information that I'm providing you with on these slides. Alrighty, so before I start going over all of the different positive punishment interventions with you guys, I want you guys to remember that these interventions that I'm going to be talking to you guys about are only considered positive punishment interventions if they reduce the behavior that they are targeting. Okay, so the first one we're going to be talking about is reprimands. And a reprimand is when you deliver some form of verbal statement following behavior that is intended to then reduce that particular behavior. An example of reprimanding someone would be like if you tell them no, or you say don't do that, or stop, or whatever form of verbal statement that will result in that behavior going down in the future. Reprimands can function as a form of positive punishment because you're adding something following the behavior, right? You're changing the stimulus you're changing in the environment is that you are adding a stimulus. You're adding a verbal response in response to that behavior that the person engaged in, right? So that's the consequence that's being delivered. So reprimands can function to reduce problem behavior, but also reprimands might function to increase problem behavior. They could possibly function as reinforcers. So there are specific guidelines that you should follow when you are delivering reprimands. And one of those is that you should be making sure that you are providing reinforcement for alternative behaviors. Okay, you don't want reprimands to be the only form of attention that an individual is receiving. You want to have frequent praise and attention contingent on other alternative appropriate behaviors, so that individuals are not only receiving attention when they engage in problem behavior. Remember that for some people, attention is attention, regardless of whether we consider it to be good or bad or positive or negative, right? For some people, if getting reprimanded is the only way that they're going to get attention, then they're going to engage in problem behavior in order to gain that attention. Okay, regardless if we ourselves view that attention as negative attention. It's not. In this case, we have to look at how that reprimand is functioning for that individual. Is it functioning to increase their behavior, or is it functioning to decrease their behavior? So in order to minimize those negative effects of reprimands, and we want to make sure, again, that we are reinforcing behaviors when appropriate behaviors when they are occurring. So there's been some research on reprimands, and some research shows that reprimands tend to be more effective when you deliver the reprimand in very close proximity to the individual rather than across the room, and when you have eye contact with the individual. So if you get close to them, you can, if it's a child, you can get down to their level and you can talk to them and say, what you did was not okay. We don't do those things, or no, or stop doing that, or whatever that reprimand looks like. Reprimands, there's also some research to support that reprimands are more effective when they are delivered quietly to the individual rather than a person being reprimanded, in a room full of individuals. And so low and quiet reprimands are more effective than those that are delivered in a loud manner or to an entire audience. So just some things to keep in mind when you do deliver some reprimands. In addition to that, there's an ideal combination of reprimands and praise. So for example, you want to have very frequent praise and some soft reprimands. And then occasionally you can include some loud reprimands in there. Okay, you want to combine your praise and soft reprimands with you want to use the praise and the soft reprimands more often, right? Especially the praise, we want that to be the most often. And then if you really need to, like in a dire situation or in a more serious situation, then you can use a louder reprimand in order to reduce the behavior. The next intervention that we're going to be discussing is response blocking. And response blocking is when you block the individual from engaging in the problem behavior or from continuing to emit that problem behavior. You are physically intervening on that behavior. That's why it's considered a positive punishment procedure, is because you are adding your physical prompts to block that person from continuing to engage in that behavior or from engaging in further instances of that behavior. And response blocking is mostly used with self-injurious behaviors in this field, or behaviors that are maintained by self-stimulation or that are automatically reinforcing. I want you all to be very cautious when you're implementing response blocking in the future. I've talked to you guys about how in behavior analysis, there is an entire community of autistic adults that have said that ABA is abuse, that ABA is traumatic, that ABA has taught them to mask who they are as people and to mask their symptoms, their autistic symptoms. And one of the things that this community of individuals argues is that behavior analysts or therapists, right, RBTs, taught them to stop engaging in self-stimulatory behaviors that were not harmful to them. So when you are deciding on which behaviors to target or not, we've had this discussion. We've talked. You guys should have watched the lecture on social significance of target behaviors and how to select target behaviors. So you should have heard me talk about whether to target automatically reinforcing behaviors or not, and when there are going to be situations when it is appropriate to target automatically reinforcing behaviors. But when you are implementing a procedure such as response blocking, I want you to have that same thought process. Should I target this behavior for reduction? Is implementing an intervention for this behavior necessary? Is it going to improve the quality of the person's life, or is it just going to appease certain people in their environment? If it's not going to improve the quality of the individual's life, do not target the behavior. If the person is hand flapping, for example, and the hand flapping just looks odd, but the person can still learn, the person can still be successful in their environment, the person is not hurting themselves, is not hurting other people, then should you really be targeting that behavior for reduction? Probably not. Okay, so when I'm saying that response blocking is often used for self-injurious behavior or self-stimulatory behavior, I don't mean that you should use this intervention for all self-stimulatory behavior. I mean that you should use this intervention for self-stimulatory behavior that you have determined is a socially significant behavior to target. Okay, that's one thing that I want you guys to keep in mind. Okay, so once you've gone through your whole process of deciding whether a behavior is appropriate to target or not, and let's say that you have decided that there's a self-stimulatory behavior that is dangerous to the person's life, or it's impeding learning, or it's harmful to themselves or to other people. Once you've gone through that whole process and you've decided response blocking is appropriate, then you can go ahead and you can use the intervention. In that case, what you do is, let's say that I've talked about this example with you guys before. I've seen a client that would rub their nose very frequently at a very high rate, and this individual would do it to the point where their eyes would swell shut. That is a harmful behavior. It is a form of self-stimulatory behavior. It's an automatically maintained behavior, but it is also a harmful behavior to them. So in that instance, an intervention like response blocking could be appropriate for targeting that behavior, for reducing that behavior. Okay. Another example could be self-injurious behavior, like head hitting. You might have an individual that engages in self-injurious behavior. You're not just going to let them continue to engage in that behavior. You're going to engage in some form of response blocking so that they don't cause further damage to themselves or hurt themselves any further. So, just some ethical considerations to think about when you are implementing or considering an intervention like response blocking. Okay, So the next positive punishment intervention that we're going to be discussing is response interruption and redirection. This is most commonly referred to as RIRD in the field of ABA. It is not an intervention that is used very often like most of the punishment interventions that we're talking about in this lecture. But it is an intervention that is used for perseverative behaviors, for very repetitive or stereotypical type behaviors or non-functional behaviors. Okay. So what basically this procedure looks like is when the person engages in this, let's say we're talking about a person that engages in self-talking. And because they engage in self-talking, then they're not engaging in more appropriate conversations with people, or they're not maybe listening to what the teacher is saying in the classroom, or they're not engaging in other activities because instead they're engaging in self-talk. Let's just pretend that's the behavior that we're looking to target. So with response interruption and redirection, we are going to interrupt them from engaging in that behavior. So we can do this by maybe presenting some vocal demands. You want to present high probability demands, meaning demands that are very easy for them and that they're very likely to respond to. And you want to present them in very quick succession. So very quickly, one right after the other, you're going to present the demand. So what this would look like is, let's say the person is talking about Disney, like perseverating on a topic, and because they're perseverating on that topic, they can't do anything else. They're not engaging in any other actions that they need to be engaging in. So what you would do is you would say, how old are you? What's your name? What do you like to eat? And they'll respond to every single one of those questions, and it's almost like you break them out of that perseverative cycle that they were in, and so then they can engage in more appropriate behaviors. So once they respond, that's that form of redirection. Once they respond to those high probability requests, you've now redirected them away from engaging in that perseverative behavior or that very repetitive behavior, and then they're probably more likely to now engage in other behaviors that you needed them to engage in their environment. That behavior that I just mentioned for you guys, if any of you guys are thinking, oh, what's the problem with talking, like with engaging in self-talk, like that's a self-stimulatory behavior, why would we want to reduce that? Well, there might be some context in which it's not appropriate to engage in that behavior, maybe in like a job setting. If you're working in a customer service type setting and you're engaging in self-talk, then maybe you're not able to respond to the customers that you're supposed to be servicing, because instead you're engaging in this perseverative type behavior or self-stimulatory behavior. So in a setting like that, maybe it would be appropriate to target this behavior for reduction. If the person's engaging in that behavior in the room by themselves and they're just on their free time, then we wouldn't probably need to intervene. But in some cases, using response interruption and redirection might be necessary. And there's different forms of this intervention too. I forgot to mention this, but you can engage in vocal response interruption and redirection, which is the example that I gave you guys right now. And then there's also some motor type response interruption and redirection where you would have the individual engage in high probability motor tasks instead. So it could be like, okay, stand up, pick up your pencil and put the pencil on the paper so that they start writing. All right, so next we have contingent exercise. Again, another form of positive punishment. Contingent exercise is when you have the individual engage in exercise contingent on having engaged in the problem behavior. So an instance of problem behavior is followed by exercise. There's a popular study that was conducted in which a child would engage in physical aggression, and each time that he engaged in physical aggression, he was required to stand up and sit down repeatedly 10 times. This is and then the behavior ended up reducing in frequency. This is an example of contingent exercise. This intervention is effective for self-stimulatory behavior, stereotypic behavior, disruptive behavior, really, I think all kinds of behavior, but aggression, self-injurious behaviors. If you've determined that that there's behavior of social significance that you want to target for reduction, then you could consider the use of contingent exercise. I've also heard I personally have never implemented a contingent exercise intervention. But like, let's say that you want to reduce a person's eating of sweets, and you want to set up a punishment contingency for, you could do this for yourself. This could be an intervention that you implement on yourself. Let's say that you want to reduce your own consumption of sweets, And you can have somebody help you with implementing an intervention where if you do eat sweets, then you have to go walk around the block for, let's say, 20 minutes. That could be an intervention that you implement for yourself. And that would be a punishment. If your behavior of eating sweets goes down, then that would be an example of contingent exercise, which is a punishment procedure, a positive punishment procedure. Okay, so next we have overcorrection. And overcorrection is when you have an individual that engages in problem behavior and then they're required, contingent on engaging in problem behavior, they're required to engage in effortful behavior that is either directly related to the problem behavior or in some way it's like an alternative appropriate behavior to that problem behavior. Okay, so first we have restitutional overcorrection. Actually, before we go over restitutional overcorrection, I'm going to cover simple correction. Simple correction is when you have the person repair the damage that's caused by the problem behavior simply by having them return the environment to its original state. So let's say that I spilled water on the floor. Simple correction would be someone requiring me to clean up the floor. So to clean up the spill, just the spill alone. But then we have something that's called restitutional overcorrection, which is where it goes beyond just simple correction. So not only am I going to clean up the spill on the floor, but they're going to require me to clean up maybe the entire room. Okay, or maybe an entire area. So it goes beyond just restoring the environment to its original state. They're going to make me engage in additional behavior that's going to bring that specific environment to a condition that was better than it was originally before I engaged in the behavior. Okay, so we have simple correction where we simply correct the behavior and bring everything back, the environment back to its original state. And then restitutional overcorrection means that we're restoring the environment and we are overcorrecting by having that person basically make the environment look better than it originally was before the behavior occurred. So I hope that the distinction between those two is clear. Typically, you want to use simple correction for behaviors that are less severe. They're not deliberate behaviors, so the person didn't engage in that behavior on purpose, or just behaviors that don't occur too frequently. Okay. Whereas the restitutional overcorrection you would want to use for more severe behaviors or behaviors that are deliberate or that they do occur very often. Okay, then we have positive practice overcorrection. And positive practice overcorrection is when after the person engages in problem behavior, you make them engage in a correct form of the behavior repeatedly. So over and over and over, you're going to have them engage in a correct form of the behavior. So an example of this could be like, let's say that you are washing let's say a child is washing the dishes and they break a dish. Well, an example of positive practice overcorrection could be that you have them wash a few dishes and you show them how to wash those dishes correctly to prevent breakage of the dishes in the future. This also reminds me of when, I don't know if teachers still do this, but in elementary schools, I feel like this was a common practice. When a child would engage in behaviors that they shouldn't have engaged in, the teachers would have them write lines over and over and over and over. I will not do X, Y, and Z. I will not do X, Y, and Z. I will not do X, Y, and Z. Whatever that behavior was. But they would have them write on a piece of paper or on the chalkboard, back when chalkboard used to exist. They would have them write over and over and over the same thing, saying what they would not do or what they should not do. You could do the same thing with what they will do. Let's look now at some guidelines for using punishment. The first thing that you want to consider is whether the stimuli that you are selecting are effective and appropriate punishers. You have to make sure that the stimulus that you're going to be utilizing contingent on behavior is actually going to function to reduce the behavior, meaning that we are going to conduct something called a punisher assessment. And a punisher assessment is really similar to a reinforcement assessment, except instead of measuring engagement or duration as you would in a reinforcer assessment, you are going to measure the overall response suppression in the presence of that particular stimulus. You're going to measure whether there were, you're going to count whether there were any negative verbalizations, if there were any avoidance movements or escape attempts with each different stimulus that you're going to be testing. And then what you're going to do is determine which of those stimuli actually has a punishing effect and which of those stimuli you can reasonably deliver with ease and in a safe manner in order for you then to implement your punishment intervention. This next one I also mentioned earlier in this presentation, but you want to make sure that you're varying the punishers that you're using and that the intensity of the punisher is enough or strong enough so that that person is not habituating to the punisher that you are delivering. Remember that you don't want to gradually increase the intensity of the punisher because the person is going to become habituated to the different punishers and they're not going to, or the different stimuli, and they're not going to function as punishers. So instead you want to start off with a punisher that is strong enough to suppress the behavior, but still not too severe where like you're causing harm or damage to the individual or it could be seen as abusive or anything like that. You also want to make sure that you are immediately delivering punishers as soon as the behavior starts to occur. You don't need to wait for the behavior to finish occurring. The moment you see the onset of that behavior chain, you can immediately deliver the punisher for the behavior, and you should immediately deliver it, okay? You also want to make sure that you punish each instance of the behavior initially. Remember, I told you guys continuous punishment of the behavior is very important. If necessary, in the future, you can gradually thin the schedule of punishment and move on to a more intermittent schedule of reinforcement. Schedule of punishment, but the intermittent schedules of punishment are less effective at suppressing the behavior. However, remember that continuous schedules of punishment makes it a lot easier for that behavior to recover if you stop punishing the behavior. Next, if you are unable to monitor that behavior continuously, then you want to make sure you have some measures in place in order to avoid that delay between the response occurring and the punishment being delivered. You want to have some system in place so that behavior is still punished and as soon as the behavior occurs, because remember, the more you delay a punisher, the less likely it is to actually reduce the behavior that you are targeting for reduction. You also want to supplement punishment with complementary interventions like functional communication training or differential reinforcement of alternative behaviors, meaning that you want to make sure that you are teaching appropriate alternative behaviors for that individual to still be able to get access to reinforcement, but they're getting access to reinforcement for engaging in the appropriate alternative behaviors. Okay, by teaching an appropriate alternative behavior, you are making it so that that individual is more likely to now engage in this behavior that's getting reinforced and less likely to engage in that behavior that is going to be punished. So you're minimizing the effects of reinforcement on that behavior that you're targeting for reduction. Our last two are that you want to watch and prepare for the negative side effects of punishment. Remember, I mentioned to you guys that you want to make sure that people in your environment are aware of the possible side effects of punishment and that they're prepared to handle those different side effects. Okay, you don't have to be, you can still be empathetic to an individual's feelings as punishment is being implemented. You don't have to be like this robotic person that's implementing interventions and they deliver a punishment procedure and they're not compassionate at all to the person that's crying or whatever emotional or aggressive reaction that they're having. Okay, we can still be compassionate individuals as we are delivering our behavioral interventions, as long as the compassionate reaction that you're providing is not going to inadvertently reinforce that behavior. And finally, we want to make sure that we record, graph, and evaluate data daily. If our punishment intervention is going to be effective, we're going to see those suppression in behavior very quickly, and we won't have to wait weeks or months to see the effect. If it's functioning as punishment, you're going to see that reduction in behavior fairly quickly. So as usual, with all our interventions in behavior analysis, we need to make sure that we are recording data, that we are graphing our data, and that we are evaluating the progress with our intervention daily. And if you're not seeing progress, then you need to make sure you modify your intervention very quickly. You should not be waiting months. This is not just for punishment. This is for any intervention that you're using in behavior analysis, but you should not be waiting months before implementing a change, or even several weeks, more than 2 weeks might be okay to see if an intervention is working or not. But if you're waiting a month, 2 months, 3 months, 4 months, 5 months to figure out if an intervention is effective or not effective, then that's a problem. You should have been constantly monitoring the progress with your intervention and made changes along the way if necessary. Okay, and to conclude this discussion on the use of positive punishment, we are going to talk about some ethical considerations regarding the use of punishment in general. So when you're implementing a punishment procedure, you have to keep in mind, not just when you're implementing it, but when you're coming up with the intervention and the behavior that you're going to target for reduction and all of that, you want to consider that the person that you are intervening on, whose behavior you're intervening on, has a right to safe and humane treatment. So all behavior change programs have to be physically safe for that individual and for all other people that are surrounding that individual, right? So if you're implementing an intervention in a school setting, you need to consider that the intervention is safe for the client, for your client, and then it also must be safe for all other people that are present in that environment as well. Okay. You should also make sure that it does not contain elements that are injurious to that person, that are going to be degrading that person, or that are going to be disrespectful to that person. Okay. Again, we as a field have had a lot of backlash from the community of autistic individuals. And a lot of them have said that their experience with ABA has been abusive. So this is not something to be taken lightly. You need to strongly consider, with any intervention that you are implementing, consider whether you are causing harm to that individual. And harm should not be only viewed as physical harm, but it could be mental harm. Okay, are you degrading someone? You should never be degrading somebody. You should never be disrespecting your participants or your clients that you're working with. Okay, so when you are working with a client, you need to make sure that you're considering that they have a right to safe and humane treatment. What you wouldn't want for yourselves, do not do unto others. So these are some examples of what humane treatments are. Humane treatments are those treatments that are designed for therapeutic effectiveness, mean that they're designed to be effective at reducing that particular problem behavior. They are delivered in compassionate and caring manner, right? I mentioned to you guys that you can deliver these punishment procedures for those particular behaviors that you're trying to target for reduction, but it doesn't mean that the individual that you're working with is bad, or that they should be ignored, or that you should be less compassionate or empathetic towards them, okay? You want to assess humane treatments are assessed formatively to determine effectiveness and terminated if effectiveness is not demonstrated. So what this means is that you want to make sure that you're constantly monitoring to make sure that your interventions are effective. If they're not effective, if your treatment is not effective, then don't continue exposing them to these aversive stimuli. Right? You should discontinue your treatment if it's not effective, but you will only know that it's an ineffective treatment if you are monitoring progress, if you're collecting data. Okay, that's the only way that you'll know. So that data collection is extremely important in our field, and it is even more important, or I guess the importance of it is highlighted even more when you're looking at the potential of you implementing a punishment procedure and not monitoring the progress, right? That could cause such significant harm to your client. So you want to make sure that you are assessing whether the intervention is effective, and if it's not effective, that you're terminating that intervention. And then lastly, a humane treatment are those treatments that are sensitive and are responsive to the overall physical, psychological, and social needs of the person. If you're implementing an intervention and you see that it's causing maybe too much emotional distress, then maybe there's another intervention that you could be implementing instead. Okay, you want to consider those things and the potential psychological harm or physical harm that it could be causing to the person. If you're implementing an intervention, maybe you came up with an excellent treatment plan and it seemed great on paper, but when you started implementing it, the person started engaging in forms of problem behavior, of emotional reactions that you weren't expecting. Maybe they started engaging in self-injurious behavior in response to the punishment procedure that you implemented. Now that's some potential physical harm that you could be exposing that individual to. So maybe it would be worth pausing the treatment and making modifications to your intervention to make sure that you are creating an environment that's safe physically, psychologically, and socially for that individual. Another thing that you should consider when you are selecting an intervention for a behavior that you want to reduce is that you should be using the intervention that is the least restrictive alternative, meaning that the least intrusive procedures should be tried first. So those reinforcement-based procedures usually tend to be more to be less intrusive. And then if those are found to be ineffective, then we can go ahead and we can use a more intrusive procedure, such as a punishment procedure, if those other procedures have found to be ineffective. So I gave you guys early in this lecture the example of a client of mine where I had been trying to manage a specific problem behavior that they were engaging in, and I had been trying for a few months. I had maybe like 3 or 4 months worth of intervention of less intrusive interventions that I had tried, and they were reinforcement-based interventions. I had tried out those interventions first, and then once those were proven to be ineffective, then I moved into a more intrusive intervention such as punishment. But first, my client had a right to a least restrictive intervention being used first. Okay. There is a guideline though that was provided by Gast and Woolery in 1987, which suggested that if a choice must be made between a less intrusive but ineffective procedure and a more intrusive but effective procedure, then we should go with that procedure that is effective. So you shouldn't select a less intrusive procedure that's not likely to be effective over a procedure that is likely to be effective. You wanna go with that intervention that is more likely to be effective. Okay. This is not the case for the example that I just gave. The example that I just gave, the interventions that I had tried out initially were interventions that had a very high probability of being effective. However, they were not effective based off of my client profile, the environment that we were in, and a lot of different factors. Okay, so just some other things. These are some additional things that you need to keep in mind. Ethical considerations for when you are selecting an intervention for your client. This now leads us into our next point, which is that people have the right to an effective treatment, okay? There's always going to be people who are pro-punishment, and then there's going to be people who are against punishment, and that is fine. Both sides have good points, valid points, right? I understand people who are against the use of punishment. They say that punishment causes possible psychological harm or has possible side effects, and I understand that, but there's a time and a place for punishment. There are situations where punishment is warranted. And I feel that these situations in which punishment is warranted is when the behavior when the punishment poses less risk than the risks that are associated with the person continuing to engage in that behavior that they're engaging in. Okay, because there are situations in which maybe where an individual engages in life-threatening severe problem behavior, or an individual is engaging in problem behavior that's not allowing them to gain anything from their environment. For example, if you have a child that's attending school and the child is throwing themselves on the floor the entire day in school, and all you need to do is get them to sit on a chair, so that you can reinforce some appropriate behavior. Well, then in that particular case, maybe a punishment procedure is going to be an effective procedure for them to just for you to be able to even get to the point of reinforcing appropriate behaviors. Okay. So this all goes to say that people have the right to an effective treatment. We don't want to withhold a potentially effective treatment just because we're afraid of the risks that are associated with a punishment procedure. We definitely want to keep those risks in mind, and we want to do things to mitigate the risks associated with punishment procedures, but we shouldn't withhold an effective treatment from someone simply because we are afraid of the effects of punishment. There really are situations where a behavior is so severe that it warrants the use of punishment. There are procedural safeguards that can be put in place, or policies that can be put in place in order to protect the client, in order to make sure that they that the behavior analyst is selecting, the least restrictive interventions, that we are giving them access to a safe and humane treatment, and to an effective intervention as well. So as an agency, some of you guys may be agency owners in the future. Some of you guys might just be employees in the future at specific agencies. As an agency, you can make sure that you are putting policies in place, such as ensuring that the person that is designing the intervention has used the least restrictive intervention first, that they have a way to appropriately measure the intervention, right? That data is being collected daily. You can ask that they are monitoring progress on a weekly basis or on a daily basis, depending on the intervention that's being used. So there are specific policies that can be put in place at the level of an organization in order to make sure that we are protecting our clients. If you're not an agency owner, there are still things that you can do. So if you're just working as a therapist or as a behavior analyst at an agency in the future, you have to do your due diligence in making sure that the clinic that you're working for, the agency you're working for, is an ethical agency, right? You have to also ask questions. You have to be the one to maybe advocate for your client and say, I'm not so sure that we should implement a punishment procedure just yet because we haven't tried anything else yet. Or you could ask questions. You could ask questions and inquire about, why are we using this intervention? Why haven't we tried X, Y, and Z? Or like just asking for the rationale for things. There's nothing wrong with asking for rationales, just so that you can understand and maybe even create a dialogue with a supervisor to maybe consider possible alternative interventions, or just to even understand their thought process of why they selected that possible intervention, whatever it might be. But there are things that you can do both as a therapist, as a future behavior analyst, and at the agency level in order to protect your clients. So now let's look at some of these policy and procedural guidelines that can be put into place in order to make sure that we are protecting our clients and that we are using punishment ethically and in a safe and effective manner. So the first one says that interventions must conform to all local, state, and federal statutes. You have to make sure that the organization that you're working at allows for the use of punishment, that your state allows for the use of punishment. There are some particular states where specific types of punishment procedures are not allowed to be implemented. And so it's your responsibility as a practitioner to to look up the laws and find out whether you are allowed to implement that particular intervention or not. Just because the intervention exists and there are textbooks on the intervention does not mean that it is legal for you to apply that intervention, okay? So you have to make sure that you are within your legal, rights to implement that intervention. The next one says interventions must conform to the policies and codes of ethical conduct of relevant professional organizations. So you need to be sure that you are meeting the ethical guidelines for behavior analysts, that you are meeting the ethical code for registered behavior technicians, any other organizations that you might be registered with. If you're registered to a particular state, you're certified within a particular state, then you need to make sure you are meeting that particular organization's code of ethics and policies. Also, if you're practicing, like let's say in a school setting, some school settings have completely different rules beyond maybe the state and local laws. Okay, so you have to be sure that you are following what's allowed within that particular school setting. Don't just assume that it's okay for you to implement whatever punishment procedure it is that you wanted to implement. Additionally, your interventions should include procedures for strengthening and teaching appropriate alternative behaviors. I have mentioned this multiple times throughout the lecture today. You want to be sure that you are teaching appropriate alternative behaviors. If you are going to be targeting a behavior for reduction, you're reducing a particular behavior, you need to provide an alternative behavior that you are teaching instead. Okay, the intervention must also include plans for generalization and maintenance of that behavior change, and criteria for eventual termination or reduction of punishment. This is super important, and I don't think it's something that we've talked about yet, but you should have some criteria for the termination of punishment selected when you begin your punishment intervention. So when you start intervening on a particular behavior that you know you want to reduce, you have to also set a standard for when you want to terminate that punishment procedure. This makes it clear for everybody, okay, we hit the criteria, now let's discontinue the use. And you also want to have plans for generalization and maintenance. So if you're implementing a punishment procedure, you need to make sure that it's generalizing across settings. We talked about, well, not that it's generalizing across settings, but that that you are generalizing that intervention across settings. We talked about the potential of behavioral contrast. So it's not enough to only intervene in one setting. We have to intervene across settings as well. So you might need to train staffs or caregivers on how to implement that intervention in other settings as well. Next, we have informed consent must be obtained from the client or a parent or legal advocate before the intervention begins. Okay, so you need to make sure that you are obtaining, I personally like to obtain written informed consent for punishment procedures. I can't recall now if written informed consent is necessary, but I think it's a good practice to get into the habit of just doing anyways. I can't recall if verbal consent is enough, but I would suggest to you guys to use written informed consent anytime that you're implementing a punishment procedure. Now let's review some procedural safeguards that should always be put into place when you are running a punishment intervention. So before intervention begins, you want to make sure that all relevant staff are trained in the technical details of properly administering the punishment procedure, so that they would know exactly when to implement the procedure, when not to implement the procedure, what specific target behavior is going to result in the punishment procedure being implemented, and so on. Procedures for ensuring the physical safety of the client and staff and the humane treatment of the client. So what exactly does that look like, right? What are you going to do if the client's behavior escalates to a certain point where maybe it's unsafe for the client? How are you going to make sure that the punishment procedure is not being overused? Okay. What are you going to do in the event of negative side effects of punishment, such as emotional outbursts, escape and avoidance behaviors, aggression, noncompliance, etc.? What specific parameters have you put into place to ensure the safety of your client and those around them, to ensure that you can maybe minimize these secondary effects of punishment? So this is all something that you want to plan for prior to implementing the punishment procedure. Next, you want to make sure that supervision and feedback of staff that you are consistently providing supervision and feedback of the staff that are administering the punishment intervention, and that as you are also, conducting supervisions and you have your therapist conducting the punishment procedures, you're not just providing that initial training, but rather that you are providing booster training sessions. Throughout your supervisions, you are providing support and feedback to the supervisees, because drift happens. Our supervisees, our therapists are going to drift in their implementation. There are other factors that will contribute to their own behavior. And so you want to just make sure that the person that you've trained to implement the punishment procedure will consistently implement that procedure in the way that it was intended to be implemented. Lastly, let's discuss the importance of documentation and evaluation, consistent evaluation, when you're implementing a punishment procedure. And by evaluation, I don't mean the evaluation of your therapist or your staff, but I mean the consistent review of data when you are implementing a punishment procedure. So we'll start off with the importance of maintaining good quality documentation when you're conducting a punishment procedure. So you want to make sure that you collect data on each occurrence of the problem behavior, and that you're also collecting data on each time that you've delivered the punisher or implemented the punishment procedure, as well as collect data on what the client's reaction was. Was there an emotional reaction? Was there any negative side effect? Was there escalation of the behavior to the point where maybe it was physically unsafe? You want to document the entire aspect of the punishment procedure, the problem behavior, etc. And you want to do this each time that the behavior occurs and each time that the punisher is delivered. Next, you want to make sure that you are reviewing data in a very consistent manner. The data should be reviewed daily, weekly. You want to review it as often as possible to make sure that you are seeing the effects that you're expecting to see of the intervention. punishment when we implement punishment, we see a moderate to pretty immediate reduction in the behavior. And so we want to make sure that we are seeing progress towards that specific goal. The reason that we want to consistently monitor our data is because a punishment procedure is typically a very restrictive procedure, and we definitely don't want to carry out or prolong an intervention that's ineffective. And so by monitoring the data consistently, we can identify a procedure that we've put into place that either is very effective, and we would see a very quick reduction in the behavior, or we can identify a procedure that is ineffective, and then we can modify our treatment as necessary or terminate the punishment procedure. And then lastly, you want to make sure that you are collecting social validity data from caregivers, from stakeholders, whoever might be involved, from the client themselves on the intervention, on the acceptability of the intervention, the treatment effects of the intervention, their likelihood to apply the intervention, etc. Because this will have an impact on whether the behavior changes is occurring, whether the intervention is actually being implemented in the way that it's intended to be implemented, etc. Okay, I hope that this helps put into perspective how we should be implementing our punishment procedures. And then in the upcoming lecture, we will discuss negative punishment.